So today we'll be focusing on emphysema. So as we all know, emphysema comes under the group of chronic obstructive lung diseases. So now let's see about the simple definition of emphysema. So emphysema is nothing but an abnormal and permanent enlargement of the air spaces distal to the terminal bronchioles accompanied with destruction of their wall without fibrosis. So now we'll go into a picture. So here we can see the terminal bronchiole which is leading to a normal acinus. So generally the emphysema happens in the acinus. So as we all know that the lung is divided into primary bronchioles, and then they reach to tertiary bronchioles, and then eventually they leads to acinus. So this is the part of the normal acinus, and emphysema mostly deals with the part distal to the terminal bronchiole, which is the normal acinus. So this is where the emphysema happens, and which is nothing but an enlargement of the air spaces. So here you can see the enlargement of the air spaces which is happening in the region of acinus. So this is a structure of a normal acinus where you can see the respiratory bronchioles, alveolar ducts, and then they lead to alveolus. So here is where the emphysema happens. So what is this? So this is eventually the enlargement of the air spaces. And what causes the emphysema? So we can go to the text there and see the major causes which causes the emphysema are smoking and the alpha-1 antitrypsin deficiency. So now we'll see the pathogenesis regarding the emphysema. So the pathogenesis of emphysema states that due to the smoking, the smoke enters into the alveolar region. So when the smoke is a noxious stimuli in the region of the alveoli, and that would stimulate an inflammatory reaction. So as the smoke is a foreign object which is induced into the alveoli, there is obviously an inflammatory reaction, and during the inflammatory reaction there is neutrophils, macrophages which come into the place to look at the stimuli, and eventually these neutrophils, macrophages releases several cytokines like interleukin 8, oxidants, and elastases, which would eventually cause an epithelial injury in the region of alveolus. And then talking about the elastases which are released during the inflammatory reaction, the main function of elastases is proteolysis. So these elastases degrades the elastin which is situated in the alveoli. So we know that the elasticity is very important for the lungs so that they don't collapse during expiration. So what this elastase does is they just injure the elastin, that is they involve in proteolysis and destroy the elastin in the lung spaces. And now we'll come to the second major factor which we saw here. Smoking is the first factor which is the reason for the inflammatory reaction in the alveoli, and now the alpha-1 antitrypsin deficiency. So now this elastase will involve in proteolysis. So normally in our body there is alpha-1 antitrypsin which checks this proteolysis. They reduce the unwanted proteolysis. So when there is deficiency of the alpha-1 antitrypsin, the elastase can easily damage the elastic membrane which is situated in the alveoli. So that would lead to enlargement of the air spaces in the alveoli. So this is the main pathogenesis involving emphysema. So as we discussed before, the main reasons are smoking, which would lead to the inflammatory reactions. So in the inflammatory reactions there is production of elastases, and secondly we have alpha-1 antitrypsin deficiency. So due to this deficiency, the elastase can easily involve in proteolysis, damaging the elastic membrane in the alveoli, which would eventually lead to emphysema. Now there are several types of emphysema. Now we'll go to the picture to see one. So first we'll discuss about the four types, which is the centri-acinar, pan-acinar, distal acinar, and irregular acinar types of emphysema. So what is it in the centri-acinar is when the central or the proximal parts are enlarged. So we come to the picture here to see this is the centri-acinar emphysema, where you can see so we can see here the normal acinus over here, and in this type of centri-acinar emphysema you can see the proximal part and the central part are enlarged. So the air spaces are enlarged in the proximal and central parts, and you can see the distal part is normal. So this part is paired. The distal part is normal. We can see the enlargement of spaces in the proximal and central part. So this type is called centri-acinar emphysema. So in this type of emphysema, the emphysematous and normal air spaces exist, and this specifically affects the upper lobes of the lungs, and the major risk factor for centroacinar emphysema is smoking. So the second type of the emphysema, as we discussed earlier, is the panacinar emphysema. So in this, the acini are uniformly enlarged from the level of the respiratory bronchiole to the terminal blind alveoli. So you can see the complete acini is damaged. You can see here where there is enlargement of air spaces in the complete space. This is panacinar emphysema, and this usually affects the lower lobes of the lungs, and the major reason is deficiency of alpha-1 antitrypsin. And the third type is the distal acinar, where only the distal part is affected. So you can imagine that the proximal part is spared and only the distal part is affected in the distal acinar emphysema type, and this majorly affects in the upper lobes of the lungs. And the last type is the irregular acinar, and as the name suggests, it is irregularly involved, so the acini is damaged irregularly. So these were the 4 types of emphysema. So generally what happens in emphysema is there is trapping of air inside the alveoli, and that leads to poor gas exchange, and that would eventually lead to hypoxemia, that is decreased oxygen in the blood, because the diffusion capacity decreases in emphysema. That is, the process of oxygen and carbon dioxide exchange between the alveoli and the blood vessels is obstructed. So eventually there is loss of elastic tissue because of deficiency of alpha-1 antitrypsin. That would lead to collapse of the lungs during expiration, and this is the major and important cause for the chronic airflow obstruction which is seen in the severe emphysema cases. So what are the symptoms involving emphysema? So generally there is dyspnea, and there is barrel chest seen in the X-ray, and people generally are noticed in hunched over position so that they can easily expire the accumulated air in the lungs, and generally these people are denoted as pink puffers. So these people are called pink puffers because, so we can see in emphysema the air enlargement is severe and the diffusing capacity is low, but there is dyspnea with hyperventilation, so that due to the hyperventilation the blood is oxygenated. So that's why they are called as pink puffers. The pink refers to the oxygenated blood, and they are called as puffers because they, in the hunched over position, they try to squeeze out the air, and eventually in the emphysema there is secondary pulmonary hypertension which is developed because of the fact that when there is decreased diffusion capacity, the pulmonary arteries constrict. So when there is severe cases of emphysema, there is constriction in many places of lungs which would increase the pulmonary hypertension, and death resulting due to emphysema is probably due to pulmonary failure and cor pulmonale, which is the right ventricular insufficiency. So that would lead to the death in cases of emphysema. So generally the epicrisis of emphysema is there is enlargement of the air spaces in the acinus, and there is dissection of the elastic wall, and the major reasons are smoking and deficiency of alpha-1 antitrypsin. So as we spoke about the pathogenesis, smoking induces inflammatory reactions that would produce cytokines and oxidants which would damage the elastic membrane of the alveoli, and the major player is elastase, which would involve in the proteolysis of the elastin. And if there is adequate alpha-1 antitrypsin, there is checking of this elastase enzyme, but when there is deficiency of the alpha-1 antitrypsin, the elastic membrane is easily damaged. And as we know, there are 4 types of emphysema: centroacinar, panacinar, distal acinar, and irregular. But the centroacinar and the panacinar are the most clinically important ones. So as we know, in the centroacinar, the central and the proximal parts are damaged, and in the panacinar they are uniformly enlarged. And talking about the symptoms, there is dyspnea, barrel chest that we can see in X-rays. The patients are usually hunched over position so that they can squeeze out the air from the lungs, and they are called as pink puffers because there is adequate amount of oxygenation, and eventually the severe emphysema leads to secondary pulmonary hypertension, and the Death. The reason of death is mainly due to pulmonary failure and cor pulmonale.